Yeah, so if you read something in the program about experiential measures, water insecurity, you're in the right room. That's what we're going to go over today. I'll be speaking for some of this, then I'll turn it over to my colleague, Christina. She'll talk about a little bit. So I'll talk about the development of some of these tools that we have to date for measuring experiences with water issues, and then turn it over to Christina to talk about the application to an intervention that Helvetas did. And then we have two colleagues joining remotely describing their experiences with using the tools and getting some political will and action around these tools. So trying to demonstrate the utility beyond just research and measurement. And then at the end, a little bit of participation, activity, feedback from y'all about some new directions that we're going in and to see how we can improve. So I have been tasked with presenting these tools. This is a lot of work from a lot of other colleagues that you may have seen come through UNC in past sessions and talk about something very similar. But in case you haven't heard about it, I'm going to be presenting on how to measure experiences with water insecurity, this intangible concept that we can't go out and measure with something like a water quality test or a biomarker. Okay. We'll see how many technical snafus we have. I don't think I have to make the pitch here too strongly that water is our most valuable resource. We use it for quite a bit, both for drinking, both for good and bad. We use a lot of water for agriculture and the food that we develop. We use it for food preparation, so you need sufficient water.
Hello, Corey.
Oh, yes, Simon, hi. Do you mind muting? Okay, brilliant, appreciate you, thank you. Food preparation and making food safe and palatable. So a lot of communities I've worked in, they talk about having enough food, but not enough water to boil it and make it soft and palatable for consumption. Hygiene is prevalent, and I know that there's a lot of hygiene experts here in the room with us right now. We also need it to not just clean our own hands and our bodies, but the surfaces on which we prepare foods, the surfaces where we're changing clothes and interacting with the environment. But water is also special that it has a lot of sociocultural meanings, and we do a lot with water beyond just ingestive purposes or for cleaning and bathing. But you can think, for instance, in this photo of like ablutions in different religious practices, sharing water and giving water to people as they come through your household. So there's a lot of stress that can be associated with not being able to fulfill these important cultural and social experiences. And then, of course, if you don't have water, it takes a lot of time and energy to go and get that water. And that creates a lot of barriers to being able to do other income generating activities, or just, again, activities that provide dignity and a sense of purpose and self. So for these reasons, we have SDG 6, and also we are currently in the water action decade. There was a recent paper coming out in Nature Water talking about how it's time to reevaluate our progress along here. Different indicators, of course, as everybody here knows, off target for most, but we are in the action decade. And I was just coming from Rome last week, where I appreciated that this year's World Water Day, or World Food Day, which is celebrated last Monday, recognizes the day the Food and Agriculture Organization was developed. Their theme this year was water is life, water is food. So starting to look at these intersectoral uses of water, and that we can't just keep existing in these silos. So I appreciated that. And there's just greater recognition of intersectoral needs of water. And as contentious as it might be, in 2010, UN came out and said that reliable access to water is a human right. But as we know, water, as valuable and needed as it is a really finite resource, and a lot of it is tied up in salt water and other ways that we can't access it. And we go to really extreme lengths as humans to get to that about 2.5% fresh water for all the uses that I described earlier. So unfortunately, though, there's a lot of water scarcity, just not enough in regions. It's estimated that about 4 billion people experience at least 1 month out of the year of living in a region with water scarcity. A lot of areas also experience water excess. So flooding is an issue that's destroying agriculture, destroying homes, destroying the water deliverance systems that we have, the sanitation systems that we have. And then unfortunately, a lot of the water is just not of great quality. There's a really great World Bank report, if you haven't seen it, called Quality Unknown, where they're describing all the different ways by which water is becoming contaminated through climate change and also huge, large-scale industrial practices and runoff from agriculture. So there's a lot of water insecurity, we suspect, these issues of both excess, poor quality, and scarcity. And in order to try to measure this and realize that human right to water, we have to be able to measure water insecurity and know who's suffering and where we need to intervene. An intervention, definition is needed first. So I conceptualize water insecurity as the inability to reliably access and benefit safe and adequate water for well-being and a healthy life. That includes dimensions, of course, of implicit in the definition, availability. So maybe you think of that as the water source. Can I see a lake in my community? Is there groundwater flowing beneath me? And physical, if it's physically accessible. So maybe the distance you're going to get that water. Between that, those two components and also a dimension of quality, that's how we currently measure progress towards SDG 6.1, recognizing or trying to figure out where people are getting their water, how far they have to go, and is it of good quality. So we have the JMP drinking ladder. All of us are familiar with this. We rely a lot on it, and WHO and UNICEF come out with really great statistics and reports every year that help give us a good sense of where we're moving to and who is getting left behind. And so currently estimated that about 3/4 of the global population has safely managed drinking water. It looks pretty good, like we're moving in the right direction, even though we're still off course for the 2030 targets. There's other dimensions, though, that aren't quite captured by just those three components. There's other aspects of accessibility, of whether the water is affordable and whether you can get it in culturally accessible means. So you can think of, for instance, people might be able to go and steal water. That's not uncommon, water theft. There's rich literature around that. But that is not a dignified practice that a lot of people want to be engaging in. And also water use. So once you actually have water in your household, you have to decide whether it's of sufficient quality and quantity for all your different household uses and decide how you're going to prioritize the different types of water that you're receiving. And also, of course, households don't just get water from one source. Often, typically, they're relying on multiple water sources, and we aren't always capturing that in some of our surveys. And finally, stability across time. So are any of these aspects changing with seasons, with climate shocks, with political upheavals, price gouges, anything like that? You can imagine that any of these could quickly be shifted another way. So we also have to be measuring at multiple time points. And the reason that this has stuck with so many people and also me is that I think of, for instance, I work in the Galapagos. People live there. It is off the coast, of course, of Ecuador. And a lot of folks have a piped water system, and I have measured the quality. A lot of it also has low coliform bacteria or none, and it is relatively clean and good water. So a lot of these communities that I'd be working in would be at the top of the JMP criteria. It's accessible, it's in their backyard, they can turn on a tap most of the time and get water. A major issue, though, is, for instance, this quote saying, when I tried to get water from the pipe, only air came out. In the 2 hours that it was available, just 10 gallons of water came out. So there's this issue of intermittency. This is the preferred system that the person uses most of the time, but it's unpredictable about when water is going to come because it's only delivered for 2 hours out of the day. Some days during that 2 hour window, there's nothing. And it has real consequences for how people manage and live their lives. So in focus group discussions, these are kind of small sample sizes, just trying to understand how lived experiences are, how everything's manifesting on the island. And of the 19 folks we talked to, more than half in response to water challenges were changing what they ate on a regular basis or deciding to eat more prepackaged foods. And you can think of all the downstream nutritional and health consequences of that. So it seems that we need more indicators or an additional indicator to maybe complement what JMP is already doing or what they are promoting that folks collect, and to maybe also consider these lived experiences. So thankfully, we have those tools available. Back in 2018, a group of about 45 folks got together and said, hey, this seems really important. We need to be able to capture these other aspects of water that we're missing. And these included statisticians, medical practitioners, hydrologists, lots of anthropologists, a few nutritionists such as myself, got together and put our heads together on how to do this. This analogy might not resonate with everybody, but what we came up with was we looked to how are other people measuring really difficult human experiences. And so we looked, and there's a really well-established literature in the food security realm of how to do this. It's over 30 years old of how to get at this thing that you can't go out and, like I said at the beginning, you can't take a test or ask somebody to provide saliva or give a blood sample and know if they're water secure or not. It requires talking to people. And so 30 years ago, the food realm was kind of where we're at now with water in some ways, where they were measuring food security by looking at food balance sheets and looking at how many calories are there per capita, how much food is there available. And eventually it became obvious that obviously that food's not accessible to everybody in the community, and it's not distributed equally, and there's different barriers to getting that food. So the Voices of the Hungry project was in 2012. They were leveraging a lot of qualitative data and trying to understand, is there like a universal way that food insecurity manifests that is comparable across countries? And they came up with these 8 experiences. I'm realizing yellow isn't great for slides, but there's a patterning to experiences of food insecurity that is universal. So first, people start to worry about if they're going to have enough. Then they start to limit the diversity of foods that they consume. They start to eat less healthy foods, and then up to the point where they start skipping meals and then going whole days without eating. So with that, they were able to develop these questions. You can use a 1-month recall, a year recall, ask these questions, and you get a nice score that you can then use to track people and understand how severely they're experiencing food insecurity, who's at greatest risk, and where to intervene. And this comes out, this is one of the SDG indicators. It's one of 2. So there's this experiential side, and then there's another one that captures the amount of malnourishment in a community. But these have really opened our eyes to the amount and the prevalence of food issues. So with the other malnourishment indicator, it looks like we aren't as severely experiencing food issues, but these indicators have made clear that not only is food insecurity really prevalent, but we're also kind of moving in the wrong direction and have been stagnant for the past few years. At around 30% of the global population experiencing moderate to severe food insecurity. So we wanted to do the same thing for water. So the first step of that is just trying to understand what's the lived experience look like. We had 40 people with different backgrounds and expertise. One of the areas I was working at the time was in Western Kenya, along with Sarah Young, Shalene Collins, Patrick Mbulo, folks who aren't here at this conference, but contributed a lot to this work. And we did different forms of interviews. One is like going along with people to their water source, asking them, what is it like when you're traversing and to go there, and what are the issues you face? And then also photo interviews. We're giving people cameras and saying, go out and photograph what is your day-to-day experiences with water. We got lots of photos and narratives that helped us to think about how we might start to ask about water issues. So in this photo, this participant was saying, when you're sleeping, you're thinking of how you will fetch water. You wake up early to fetch water, even at 3 in the morning. So people trying to beat these cues, and just the psychosocial toll was there. And so clearly, like food, there's a lot of worry about water. And then also, biased because nutritionist, but there was this quote also saying, there was little water, hence the porridge was little. The children were fighting over the pot, and I told them, you're the ones who were tasked with getting the water. Therefore, like, this is the issue that we have. So thinking about how food and nutrition have to change also. So we took all of our 40 different backgrounds and experiences and came up with a list of 32 items that we thought are going to capture this experience really well, but nobody has the budget or time to implement 32 questions regularly. So a big part of scale development is parsing it down. So we implemented the tool, this survey in 28 sites globally, and we tried to pick sites that had really diverse regions, diverse populations, different water issues, different water infrastructures, different seasons, and trying to stress test these items to make sure that they perform well in all regions of the world. And ultimately, we came down to a set of 12 experiences that have been shown to be comparable, meaning that the scores you generate in one region can be used in another. And there's actually four versions, really. There's the household version and now an individual version, because we know water issues aren't experienced equally within a household. Some people have prioritized access to water or have greater burdens of going out and having to acquire the water. There's the 12 item 3-minute version. I also know it's 3 minutes to implement, both anecdotally, my own use of experiencing it, but also because it has been included in the Gallup World Poll, and they charge per minute and they care a lot about timing. I'm not going to present it today, but there's a 4-item version, which is just those 4 experiences that you can use for rapid assessment if you just need the prevalence of water insecurity, but not knowing all of the nuanced experiences. So with this tool, it is, like I said, 12 experiences. The items take the form of something like, in the past 4 weeks, how often have you worried you wouldn't have enough water for all your household uses? How often have you felt angry about your water situation? How often have you gone to sleep thirsty? So a range of severity of experiences. And you ask those, people can respond from never to often or always. We have like number of days and times associated with that. And so let's say now, for instance, some of the folks I was working with in Kenya, if you implemented this, I could talk to this mother here and she could tell me, I'm really worried about water. It happens actually quite a bit. I only thankfully once in a while have to change what foods I was going to prepare, pretty angry about it, and so on and so forth. You take these, it's 0 to 3, you add it up, and now you have a score that you can assign to this household or this individual. So 14 is pretty high on this scale. The range is 0 to 36. The provisional cutoff right now is 0. Scores higher than 12 or higher are indicative of water insecurity. We have a paper under review right now of talking about even things as much as like 0 to 2 is maybe low water insecurity. Then there's a mild form and then a much more severe form. And actually the 12 or higher, we would say, is like severe water insecurity. You're experiencing at least 4 of those items, often or always. And my colleagues will get into the uses of these tools, but they can be used to identify at-risk populations, monitor and evaluate programs, and also understand the consequences of water insecurity for well-being. And this aligns with the Water Action Decade. One of the subsections is saying of improving knowledge generation and dissemination of the issues of water, including new information related to water-related SDGs. So these help complement what we already know. I'll quickly go through this as a plug of where we're at now, since we last presented on this. Of the tool has now been included in 2 waves of the Gallup World Poll, and these were measured at the individual level. So now we can start to track who is water insecure and what does it look like in countries, because these are nationally representative data. And you can see in some regions where the tool is implemented, for instance, Kenya has about 45 to 55% of the population is water insecure, and in some regions more than 55% is. So there's a spread of severities. If you look at this overlaid with the JMP maps, you might get an interesting or complementary story, or you might find some settings where people have an improved water source or a high improved water source, but also really high water insecurity. And like I said, now that we can start to disaggregate these data and look at different backgrounds and demographics to understand which communities are at greatest risk, I picked one that fits conceptually nicely with how we typically think of water. I'll tell you, there's a lot of settings where it doesn't look like this. So this graph is saying, if it's the dot is to the right, that's saying that in that country, more women were water insecure than men. It's not always the case. Sometimes it's flipped. It's worth looking at the paper because it kind of goes all over the place, and it's context matters, as many of us know. And finally, the last piece that I was talking about is that it's revealed just helps demonstrate the importance of water and can maybe motivate more action around this by showing not just that water is important for its own sake and for drinking, but it also has really severe consequences for a lot of other things that we care about in public health. For instance, food insecurity. So if you are water insecure, you are in this finding of 2 to 3 times more likely to also be food insecure. And this is controlling for all of the other things that we know to be associated with both of these, like wealth, like location, like region, like age. These relationships persist and are really strong. Also, clear impacts for sanitation. This graph's really tiny, but it's showing how many people in our surveys had said that they had skipped washing their hands due to issues with water. And in some places, you can see that, like for instance, in Punjab, Pakistan, about like 3/4 of the participants said that they had skipped washing their hands due to problems with water. Water is contentious, another tiny graph, but these are questions talking about interpersonal conflict and both so within households and then outside households of talking about violence. So people are talking about queuing in lines, starting fights, having fights because of the issues of water, or also the domestic issues. And there's whole other literature. It's cool to see the uptake of this tool in the past 5 years. So this is a self-plug of looking at mental health and well-being is, of course, really strongly associated with food and water insecurity. Other folks have been looking at this in like refugee populations, doing stuff inside and outside different camps, trying to show that there are real differences in how this experience manifests. And also as far down as HIV viral load and symptomology of AIDS among people living with HIV. So really severe consequences of being water insecure. So for instance, one of the pathways that we think here is that people were saying that when they don't have enough clean water, they have to prioritize what they're going to do, and they might skip medications, or they've been told that the medications that they would use to suppress HIV viral loads require additional water consumption, and they just don't have that. So they'd rather skip the medicine sometimes. Tool's been implemented a lot of places, now by over 100 organizations. This map's about 2 years outdated. And like I said, Gallup World Polls used it. Feed the Future requires it. So that's USAID's Food Security Initiative, Global Food Security Initiative requires it in midline evaluations. The Mexican government is signed on and started using this in their National Nutrition Survey. So here we have NHANES that you might be familiar with. The counterpart in Mexico is NSANU, so Nationally Representative Food and Water Insecurity data, and then different groups like Oxfam, Action Against Hunger, IFPRI, we'll hear about Helvetas and some other groups that have used it. And I'll make one final plug of, we recently got to meet in Mexico City with a bunch of organizations that throughout Latin America and the Caribbean that were like, this is important, we need to measure this, and we want to elevate this to the level of the national governments, and our regional governments as well. So if you're interested in this region of the world, interested in water issues of this region of the world, please feel free to email here and get connected with that network. It's like a monthly newsletter right now, but it keeps you up to date of what's going on with this. And it's a space where you can share your research, your findings, and also policy impacts. I'll say that there'll be room for questions and stuff after the presentation. So I'm going to hand it over now and take your questions later, but thank you.
Thanks, Josh. It's just really cool to see the whole journey of this new scales. I'm curious, has anyone in the room used HYs in their surveys? Yeah, I mean, like, that's super cool. There's like 10 people in this room that have used these scales. So I'm going to zoom in on just how we've been using it at Helvetas. And just to start, I'm very much representing my colleagues, both in Nepal and Switzerland. And so I'm just one small piece of this whole work. And then also very much with Josh and Dr. Sarah Young on all of this work coming together. Also quickly to point out, beyond the research partners, the funding partner on this is Charity Water, and they are the primary funder of this work that I'm going to go through in Nepal. Oh, that's fun. So just a really quick overview of kind of how Helvetas thinks about our water portfolio. If you're unfamiliar with Helvetas as an organization, we work in 30 different countries, and we have WASH programs in about 15 of those. We think of a lot of our programming through this kind of systems change model, which you'll see on the right if you're familiar with market systems development. So we really do think beyond kind of infrastructure, but also make sure we have components of governance and behavior change, and really look at a full system before we implement a program.
I messed up your slides.
Okay.
You had them look pretty. Let me take you over to yours. Yes.
So there's just a few things that I was going to highlight. Oh, perfect. Oh, that was quick. Just a few kind of pillars of what we work on. Water use master plans, which I'll talk a little bit more about in this program in particular, but we also do what we call blue schools. We use the RANAS behavior change approach, which you've probably heard about, which came out of AVOG, and then WASH Fit, which is the WASH and healthcare facilities, which I'll plug. There's a session tomorrow morning on WASH Fit, so you should go to that. Great. So to head to Nepal here, this program is an integrated water resource management program. It's being implemented in 11 rural municipalities in Karnali province, which is in northwest Nepal. Just some quick kind of baseline. What does this region look like? What's happening there? You have about 2/3 with an unimproved drinking water source in this area. And interestingly for me was kind of what that actually looks like. There is a large majority of these folks that do have piped connections, but they're unmanaged. So there's leakage, there's pipes above ground, things like that. So in some of these instances, you do have folks with actual household connections, but they're really poorly managed. And then kind of quarter of the folks in this baseline also have basic service. So again, we're not even getting up to like basic service in these populations, with a median collection time of about 25 minutes. So quickly on just what is the intervention, if you will, here. We think about this in kind of 4 components. So the first is a water use master plan. And this is a participatory inclusive planning process. It is about WASH, but it's also about a lot of other uses in that particular community. It's a 5-year plan, and it's fully like they cost it at the beginning of this process. There's also a component of water scarcity to this work. So we think about land management, recharge, and conservation. So just to again say, these programs, we don't think of them primarily as just WASH programs. This is a full integrated water resources management work, where you do have this capacity building and kind of participatory assessments through the whole process. But then finally, you think about infrastructure. So in this case, this project was doing source protection and these more robust household connections. So the kind of results, high level of the project, this was implemented between August of 21 and January of 2023. About 70 piped water systems, 40 communities, greater than 35,000 unique water users. And at the end line of this program, you did see all households get up to 100% basic service level. We definitely don't want to say safely managed yet. We're not totally sure about if we're really reaching that full functionality, but you do have household connections across this population. So now let's get into that connection with HYs. So I think it's really interesting. Josh showed this kind of figure in his work, and I think that's a real starting point for why Helvetas was really interested in this scale. So we know there's good indicators for the things you mentioned around use and infrastructure and quality, but there's this whole other part of access and use that is really not being addressed, and we're really seeing those in our programs, and we're really interested in how do we assess this? What is the work being done here? I think we were also very inspired by I think Josh also showed this picture of this group of researchers, and We were at a knowledge sharing group with MWA folks and saw Sarah present, and she presented to us, and it was a really interesting measure for, again, when we think about holistic programming, that we're not just in this, what is the most objective measure of what's happening here, but how are people actually experiencing these water projects? And then a few notes on the pilot. So this is very much the kind of pilot side of this, of working with HYs in Nepal. Luckily for us, the survey was kind of already translated into several languages, and for you too, it might already be translated. It's already in Kobo, I think, and again, really easy to use. I will say very specifically, my experience is, again, it's a 12-question survey, 3 minutes. Like I'm sure many of you have done a baseline survey that is getting longer and longer and longer. And this ends up being a really easy component to put in with some really substantial evidence at the other side. So that's my quick plug for that. There's a really good training manual. And just generally, we do a 400 household survey, and for the work on this, and we randomized that to grab 109 households for this survey in particular. This was a pre-post survey. I think this is the only HY's one that's a pre-post. Do you know of any other ones? Okay, so that's a lie. That's not true. No. We're not the only one. But we did do this as a pre-post survey, which I'll show in a minute. We did seek the same respondents on both sides of that, and we're able to get 83 of the original respondents. So yeah, results. So the first graph here on the left is showing the overall prevalence of household water insecurity. Obviously, we're seeing very significant results here from a score of 21 down to, or water insecurity dropped steeply from 21% to 1.3%. And then over here, you can just see generally the trend towards a decrease in water insecurity. We do have we had like 5 households that started at 0, so there was no chance of improvement, if you will. So that's kind of what you're seeing here, just a really drastic level of decrease in household insecurity here. And then these are the 12 metrics kind of broken down even further. There's a lot to really unpack here that we are still unpacking in this kind of pilot phase of this work, but you can really start to see what you can kind of learn from this data. So for example, like what's happening here with clothes washing? Why isn't this intervention kind of eliminating this worry around clothes washing? How can we look into that? Also not shown here is when we looked at this data, there was one region in particular where the insecurity measures was still quite high. So abilities to kind of target those particular metrics. So overall, this can give you a little bit deeper of a picture of kind of what's happening within the project when you start to really dig into these 12 metrics. And then just to give a couple of insights on using HYs, we'll be curious, after the session or in breakouts to hear some more of your thoughts on usage of HYs. I think these can be difficult questions, especially at the beginning, to train enumerators and to work with them on. So this, like, what do we mean by worry, anger, shame in different cultural contexts can be a little tricky. And so this is something you do typically need to kind of dig into with your teams for that particular context, and making sure you're kind of getting the question right in that way. Because it's an index, you do need all 12 questions answered, though I think you can do it with 11, with Josh's statistical powers. But not all respondents were able to answer 12 questions. So this is also something that we're continually working with our enumerators in the field. What does this mean? How do we talk more about specifically a lot of these things around like worry, anger, shame, that type of thing. And then just some other really quick takeaways. We do think that this is a useful scale, and Josh went through the many programs that are implementing this. We as an organization, Helvetas, have now included this as a KPI in our new strategy. So we're excited to look at this across our portfolio of projects. We do think this provides additional insights into dialogue and advocacy. So again, when we think about systems change, like advocacy is definitely part of that, and being able to speak to people's experiences is really helpful and important in that conversation around advocacy. HWISE helps pinpoint where issues might remain. Again, I mentioned, particular areas or parts of the scale that we may be able to target a little bit more. And then is really this just add-on piece to what is being seen with SDG 6, and really thinking about, okay, I have a good idea of basic or safely managed. What else do I need to know? And this provides like this experience side of human emotion and what people are actually feeling related to their water. Again, quick plug for all our program partners. They're awesome. And that's it. Thank you.
Nobody's paid to say nice things either. I'll make that clear. This is just, yeah, I always appreciate hearing the like struggles of using the tool too, because it is real of like, yeah, trying to train enumerators on how to ask about these things. And in the manual, we try to provide optional or different things that you can use to probe about these questions, or if people are really stuck and can't conceptualize it, alternative phrasings. I'm gonna now turn it over to my colleagues on Zoom. Let me see. Okay, Greg is here. Okay, hi, Greg. Greg is a professor of chemical engineering at the University of New South Wales and is also the director of their Global Water Institute, and has also had experience with using these tools. So I'm going to try to figure out how I can get you, let me see, if you can start sharing your screen. Let me see if Greg, do you have the option to share your screen? Let's see
I do.
what that looks like.
Hello everyone. Sorry for the technical glitch earlier. Yeah, it's I can share the screen, but it's saying that you're sharing yours, so I can't share mine.
Okay,
so
wait.
I think you need to stop sharing. Yeah.
Now, what if you give it a try?
Now I think we're in good shape.
And now it's like, how do we get that?
How's that?
Messaging.
We're close. We just now need to get this onto the screen in here. And I don't use PCs, so I don't know how to do this.
Who was?
Maybe Mole. I feel like it's like presenter view versus the like view of
Quick things that I don't know about.
I know.
Tell you what,
have-
we've messaged IT, so they should roll on down in a minute.
Oh, beautiful.
There we go.
Do you know how to transition over to sharing that screen?
Alrighty.
Amazing. Okay,
There we go.
you're in. Back to mainframe. The floor is yours, Greg. Thank you.
Good morning. Well, thank you very much, Josh. Thank you everyone for the opportunity to be here. And my name is Greg Leslie. I'm speaking to you from Fiji, but normally I live in Sydney, Australia. I'm going to, well, before I begin, I do want to thank Josh and Sarah and Simon, who we've had the opportunity to work with, and Sarah introduced the HWISE tool to a project that I'm involved in. It's not my project. The project belongs to the Darawa Elders Group, which are an Aboriginal First Nations community in a town in Western New South Wales that we've had the privilege to work with over the last 6 years. And so I'll share a little bit of the information that's in the public domain, but this is really their story. And, you know, I don't speak for their community. So I'm going to talk about how the HWISE index can really shift public opinion and government allocation of resources in ways that more conventional water quality data does not. So to talk a little bit about the scale, you know, this data is from Gallup, was organised by Sarah, and it says Australia basically enjoys very high water security standards. You know, less than 1% nationally have water insecurity. And you would expect that because, you know, Australia is a G20 country. We enjoy a very enviable gross domestic product per capita. We can afford that. But when you move outside of the capital cities, most of us live on the coast. So when you move inland, particularly into towns that rely on both groundwater and surface water, the blue map on the left is a schematic of what's referred to as the Great Artesian Basin. It's a massive underground groundwater source that spans around about a third of the country. The town that I'm going to talk about sits not only on the Great Artesian Basin, but it also sits on our biggest inland river system, the Murray-Darling Basin, that really drives a lot of our agricultural production in Australia, agriculture being the second largest export that we have behind minerals and resources. So the issue that we have is how do towns that are away from the coast, small communities, a lot of high First Nations population, deal with climate change, particularly when they're trying to transition between groundwater and surface water. And so this is a photo of the river in Walgett, the town that we're particularly interested in. That on the left is between 2018 and 2019, and you can see there it is bone dry, and that is the reality of climate change in that part of Australia. Our summers are becoming warmer and drier. The flip side of that is intermittently we have less frequent but more intense rainfall events. So that same river, it's probably a little bit difficult to see, but some 4 years later was totally flooded. And in fact, the town was isolated. And so you have these communities that that had traditionally relied on river water. The rivers were healthy before colonisation. Mismanagement of the river or different priorities for what water is used for have resulted in these problems. And these communities need to transition between river and groundwater. And particularly in very prolonged droughts, which can run up to 3, 4, 5 years, they're on groundwater exclusively. Now, the problem with groundwater, and this was revealed by the community in some work that we did with them, was that the groundwater has around about 300 milligrams per litre of sodium. Now, the aesthetic guideline in our Australian drinking water guidelines, like your EPA regulations, is that sodium should not exceed 180 milligrams per litre for palatability, not for health. But the reality is when you have a population that has a high incidence of hypertension or renal problems, doctors would recommend that if you're on hypertension medication and you're drinking water that has more than 20 milligrams per litre, you're beginning to undo the effects of the hypertensive medicine. So we worked with the community to try and vocalise, for want of a better word, help them advocate for change, to install treatment processes, typically membrane processes that can easily deal with that problem. Now, using the language of traditional water quality, this was the response we got in 2019. One newspaper ran a story, New South Wales considers options after concerning levels found. And really nothing happened beyond that. There was concern, there was public discussion, but there wasn't a lot of action. Using the HY scale as part of an NH and MRC project, and that's our National Health and Medical Research Council, at the end of 2022, beginning of 2023, the community, with the support of the researchers, canvassed 254 people. The population of the town is 1,400, so it's a good representation. And these were the data. The HWISE tool cut right through. 84% experienced interruptions to the main water supplies. 91% had concerns. 68% were anger. 4 out of 5 were concerned about the quality. And also additional data that we collected was that people were spending between $30 and $50 on bottled water because they couldn't drink the water coming out of their tap. And that's in a community that doesn't enjoy those standards of living that I was referring to before. When this information was presented, it went from a minor story picked up by a couple of online newspapers to a major story picked up by the national broadcaster. Walgett drinking water quality river systems concerns aired by distressed residents. The town where Coca-Cola runs more freely than drinking water. Talking about the pricing differential between carbonated sugary drinks and bottled water in the supermarkets. And that really galvanized action. The water minister, the chief politician responsible for water, immediately visited the town. Commitments were made to operationalize equipment that had already been installed but had never been used to deal with the salt problem. So the point that I'll make briefly in this talk, and again, thank you for the opportunity to present this. As I say, it's not my story, it's the story of the First Nations people that really led this work. But the HWISE tool allows us to move this conversation beyond traditional water quality guidelines. That's really important. And it helps galvanize the community to petition for those resources that they need. And it is a credit to them. And so the Darra Elders Group, along with the Walgett Aboriginal Medical Service, deserve all the credit. At my university, we have the UI Narrowly Community-Led Development Program, and also the George Institute for Public Health, a leading non-communicable disease and renal research centre. And so thank you.
You can't see it. Huge applause, standing ovation over on our end. Thank you, Greg.
I appreciate that.
Yeah, it's really inspiring. And thank you. If you're able to stick around, I know it's very early your time. We'll take questions.
We're wide awake now. The day's got off to a great start, Josh, notwithstanding the technical difficulties.
Beautiful. Well, we'll take questions in just a moment. I'm going to turn it over now to our colleague Simon, who's joining us from Kenya, and let him share his screen if you're able to do that, Simon.
Yes.
I think you have access now.
Do you have it?
Ah, brilliant. Yes.
All right. So, yes, and you can hear me?
Loud and clear.
All right. Yes. So this is Kajiado town, and this is you can say the headquarter of the district. And what you see is a lot of infrastructure, roads, many buildings, tens of thousands of people. And one thing that is ubiquitous is these trucks carrying water, and also donkeys carrying water and people carrying water all over the place. Yet there is a lot of infrastructure that has been put in place. It's not very clear, but even the person at the top of the right-hand side is transferring water from a truck to a tank in the building. So this is the location of Kajiado. It is on the border with Tanzania, between Kenya and Tanzania. It's a really dry county. It's had more than 7 failed rain seasons that's resulted in a lot of losses of livestock, because the main livelihood of the people living there is pastoralism. But at the same time, there are significant areas with heavy population. These are the peri-urban and slums because it's close to Nairobi. As I mentioned, there is a lot of infrastructure, both rural and urban, but most of it is non-functional or suboptimal in functioning. So in terms of background, the area is about 20,000 square kilometer. As I mentioned, we have a lot of impacts from climate change, and the average distance of people walking to look for water is 4.5 kilometers in one direction. That is looking only for a 20-liter jerrycan of water. You can see some women there. This is a daily exercise. Only during the rainy season, maybe less than 10% of the time do they get water any closer to their homes. And over 30% of the population does not have access to safe drinking water, and sanitation is even worse, up to 95% of the population. So I think you've heard about the household water insecurity. It tries to address issues which have been left out of the conventional way of looking at water security. That is because the conventional systems that we have do not capture many ways that water access can be problematic. And there is a lot of masking of differences between population, and it cannot quantify the different impacts on individuals. And so these HYs, it helps to identify populations which are vulnerable to insecurity, also to understand the causes and consequences of insecurity, also track trends in household water insecurity over time, and monitor and evaluate the impacts of water policies and programs. So in our survey, we targeted 1,300 people, but we carried out 1,559 surveys because it took a bit of time for our enumerators to understand exactly how to ask the questions, and also for the backup team to be able to interrogate the data and to be able to send them back where they found that there was inconsistencies or information were not right. And as a result, we found that 70% were water insecure. And the questions were, as Josh mentioned, and some of my other colleagues was about worried about water, had water interruptions, had to eat differently, could not wash hands, and so on. And we found that these questions were very, very incisive and helped overcome the traditional challenges of asking about, water quality, reliability, and so on. This could give very, very direct responses, and it was easier for the respondents to give specific information about challenges they were finding with water, whether it's quality, availability, and even pricing, and so on. And we have now tried to move from just responses. What does it mean? Because in the meantime, the Kajiado County government is trying to develop or to formulate a water policy. And what I would say is that even though the technical officers, the engineers and so on, understood the problem, they understood the implication of the results of the study and the potential solution, they rejected the incorporation of this system into the monitoring and evaluation system that they use at the moment. And this was because it was going to give them a difficult time explaining all these very, very difficult, very, how do you say, unsavory responses from the end users. And but in a back and compliment, I was invited to develop the county water policy for Kajiado. And what I'm doing next is to see how to incorporate HYs into the monitoring and evaluation system for rapid response to problems that are affecting or afflicting, or everybody from the technical people to the administrative people can understand, but in a way that does not expose the technical officers who are supposed to be managing these facilities. And what we find is that it can help to deal with frequent leakages, with vandalism, with wildlife breakages, because there is a lot of human-wildlife conflict in the area, but also the wildlife are always searching for water. And initially, I thought elephants were the most damaging, but it turns out hyenas are even more persistent, and there's many more. So in terms of how are we moving forward, it's incorporating a statement in the draft water policy explaining about the lengthy period of obtaining feedback from water users on effectiveness and efficiency has contributed to the non-revenue water and heavy expenditure on repairs and replacement of equipment and reticulation systems in many cases, and also stalled water projects because a stitch in time is not done. So even whole systems are lost. This is quite serious because in Kenya, it's estimated up to 1/3 of the water budget would be saved if they only responded on time and reduced what is called non-revenue water due to leakages and other things. So one of the actions that has been proposed is entitled Agile Citizen Oversight and Community Stewardship, which sounds very good to the politicians, because after all, we do want them to pass the policy. And then this one is a help to address the issues promptly for swift, cost-effective solutions in water and the sewerage treatment systems. There are also a lot of illegal connections, if you know how things work in developing countries, and so on. So I would say the lessons from that is that infrastructure is not service. As I mentioned, infrastructure worth trillions is lying unused or underutilized, despite lots of connections. This is how connections to households or community water points. A lot of people are struggling to find water for food and household activities. So IWISE and HWISE, they offer utilities early warning that operations are compromised where it matters most. And this is at the point where they get paid for the services. And very important, utilities can save millions of dollars, not just Kenya shillings, in avoided repairs by responding to consumer feedback. That is the stitch in time. And then for the future, what I'm trying to see is if this will be possible, moving from the policy to the regulations to operational procedures and practices, they need to change the practice towards rather than relying on monthly or annual reports, so that we move towards HWISE and IWISE where we get continuous feedback. And second is because, as I mentioned, management is not comfortable with users finding ways to report subpar services to decision makers, especially the politicians. So we need to get them to understand the value of early feedback, but at the same time, we need to engage political and senior administrators to understand how to improve services by asking for accountability to the user feedback. Thank you. I'll stop there.
Thank you, Simon. That always shocks me how powerful and political data also can be. And we know this of not wanting to release reports and the power of getting to go out and own our own data and doing this sometimes. Before I present any more, I want to just give an opportunity for any questions that people might have. So feel free to come up to the mic or raise your hands. And as a quick recap of what you've heard thus far is how these tools were developed, where they've been used, impact in Helvetas project among First Nations people, and also now in Kenya. Yes. I can repeat it also for any of our panelists on Zoom.
And so one thing that came up that surprised us, we did pilot this on a really, really small scale, but one story was from the field. There was a gentleman who's older, and when asked these questions about whether or not he had to worry, he said, I don't have to worry about water because God will take care of me. So it was really interesting to see that even though he had really, really poor access to water, there's disparity between what he perceived as his worry or access to water. And right, to have worry is to be aware that there's an alternative. And so that was really, really interesting to us. And I was curious, are there ways that we can incorporate that tangible objective access to that services in the HY scale so that it is leveraging both like his office's own practices versus your.
I will just quickly repeat this of, in case you didn't hear it, Zoom colleagues, of a question around one person who's implementing the tool had found that somebody had said, well, I don't worry because I trust in God, don't stray from God, and yet was facing really substantial water problems. And that's actually, well, I'll say working in Latin America and the Caribbean, that the translation of the word worry. So in some languages, there's upwards of more than a dozen different ways of defining like anger or worry. And so sometimes it's been working with people to know what ones might actually get at the emotion that we're talking about that isn't as charged or could lead to those responses. Because we got a lot of that of like, if I'm worrying, then I'm saying that I don't have faith in my religion or and also what you're saying though of leveraging both data sets. This is not in either or. I think it's a plus and, which I know is a big ask a lot of the time to different donors and agencies. But when you have both of these data in hand, you have a really good sense of where the water issue is. Is it the system and the infrastructure? You can see it's being delivered, it's working well, and yet this person is also experiencing a lot of these issues. So I think that's where the benefit of combining both, and that I will make a plug, like JMP, those criteria are really helpful if you can ask about water source, distance to source. They also a question about reliability, and then if you have the means and ability to capture water quality, that's really takes you there. You have a really holistic picture of somebody's water source. I don't know if anybody else has any other thoughts. Yeah, okay.
I'll do that like a really brief, like adding, so like you're saying like adding both the water access.
Mhm.
That in like a discussion or like a approach
Mhm.
analysis of what's going on versus like their access for some areas of the
Yeah, and like some graphs that we have that didn't make it into this presentation, but ones where you're looking at, you could do like a binary of whether you have a safely managed source or not. And then you look within that and you say, what percentage of people are water insecure? So for instance, it would be really interesting to know if a household has a safely managed source, but they're still water insecure, or the other way around where you don't have a safely managed source, but you aren't registering as having water insecurity, you have a really low score. That would imply that somebody is using really clever management and adaptive strategies to make the most of their water. And that doesn't mean that that person doesn't deserve like safely managed water, but that might imply that there's something worth investigating of understanding how people are like persisting and working within those water systems. So yeah, again, the combining of data goes both ways because HWISE doesn't tell you the full story either.
Thing I would add on is just, it would be helpful to learn which context you're working in, if there's other people that are working there. And
Yeah.
I think part of the reason for this is like trying to connect folks, and like we found that the survey was, already translated in the languages that we needed, and so we were able to leverage that. And so I don't think we would promise that to anybody, but like it would be helpful to do an exchange, because I mean, Josh was literally saying the exact same thing to me yesterday that you just said. And so I think we can do some like at least context building on how to ask these questions better, and that's like a continual improvement of the tool itself, which we're always going to be interested in.
Yeah, definitely. These aren't static. So what's the context? Dominican Republic. Okay. Yeah. No, I mean, it's no fault. I mean, it's M&E budgets are low sometimes, and it's also really hard to do all of this and invest the time. So even just getting some of those data are really helpful. And thank you. That's like helpful information for us.
Implemented these scales in a project that I'm working on in Indonesia and Fiji.
Oh.
In urban informal settlements, and in both contexts found much lower water insecurity than we were expecting, like working with local partners who know the context well.
Yeah.
And so for that reason, I was excited to hear about this like multi-threshold option, rather than just a yes, no, this.
Yes.
Here, to potentially get at some more of that granularity.
Mhm.
I'm wondering if there is a version of that for, first of all, I'm wondering, what the rationale for that was. You could
Yeah.
speak to that a little bit, just curious if it was, both like we were
Yes.
expected, and then also if there is that multi-threshold option for the short form.
Yes. Okay. Questions about severity and scaling and scoring and low water insecurity. Well, also I'll say that like working in the Galapagos, I was expecting really high water insecurity. People are regularly experiencing these issues, but with the 12 threshold, that's considerable. You could either say rarely to all 12 experiences to get there, or you could say that you experience 4 of those issues often or always. That's substantial. Like if you really think about what that means in somebody's lived experience. So it was kind of the theoretical. So when we first did all this scale work, it was like, we got to get this published. And as soon as we were about to publish it, it was like, and nobody wants a continuous indicator. That doesn't help anybody. You have to come up with a threshold. So then we did some statistics. And now that we're a couple years out, we've had more time to like dig into what does, and we've played around with it quite a bit, and the peer review process takes forever. But I can say that yes, it's because of the policy implications, the reality of knowing that 12 is really severe. And so I think if I'm remembering the provisional cutoffs, and nobody on the team would be upset about this, is like something like 0 to 2, 2 to 11, and I think 12 or above. We have 4 cutoffs. But anyway, I could share those with you because it creates a much better picture of like helping to understand. And because again, I think the beauty of the tool is that to not binarize everything. So you can see whether, for instance, like Christina was showing of yes, no, did you say this? But you can also see the frequency. So in those data that we have is also a lot of people were saying things were happening often or always. And then you can see that they either shifted to never or rarely. And so in the same way of water insecurity, it's going to take a lot sometimes to shift somebody from water insecure to secure. And we were like, there's got to be a better way to capture these interim time points. So the water insecurity scale is also like a nice interim thing of like, it takes a lot sometimes to move a whole community to an improved water system, or these really large scale interventions to have impact. And this helps you see some of the process of how is it impacting people. So that was long-winded, but yes.
Yeah, I know there's a research coordination network, and when I completed my study of H-based data, I
Yeah.
compared to water-related emotional experiences too.
Uh.
So like in a far northern Ethiopia, they were speaking words that like best describe their experience with water from a sort of
Oh,
positive and negative, active or passive.
yeah.
And I kind of completed my PhD and was thinking about it for a while. After that.
Yeah.
Research coordination network would be a good
Yes.
way to maybe get more experience.
Okay, we're making a plug for HY's repository network. No, yeah, no, I think that's great. And just venues like this of data sharing and collection and sharing those out, and great on you for also making that open access. So that's cool. Yeah. Buried in something, yeah, through 7 layers. Any other questions? Yes. Yeah. Yeah. Mhm. Yeah. So validated, as you rightly point out, in low and middle income contexts or countries broadly, but so Sarah is brainchild of this like unspoken person in the room. She's on sabbatical and she said no thanks this year to coming. So that's why you're not seeing Dr. Young here. But in terms of validating in high income countries, I think one, the stuff from Australia is showing that it's fitting how we would think, and that there's like these, it's called like known group analysis of, you know, that certain groups are going to experience water insecurity and shouldn't. So it's like internally consistent, but there's much more rigorous statistical tests that need to go into demonstrating this. And so I'm not fully apprised of this project, but I know that there are people, including Sarah, who has a network right now trying to do cognitive interviews with people in, like, for instance, like Appalachia, Puerto Rico, a few other countries in context of like trying to understand if there is some part of water insecurity that is different or need to probe about. And TBD on that. I don't think there's any huge data efforts. You might have insights into this. You may have been one of the people who interviewed.
I just know Asher, like there are meetings happening about
Yeah.
doing this at night.
Yeah.
In the next month or two.
Yeah. So there is like some, like, for instance, like I know that this was implemented among like First Nations people in Canada, and there's similar stories there of like the power of these data, and it works really well within those groups. But to say, from what I've heard anecdotally, it sounds like there might need to be an explicit question about cost and affordability, as opposed to just implicitly basing it off of how people shift their activities. It seems like cost is maybe a really big thing. And I think that's actually kind of the only thing that's come out of it, because we also had tested quality items, and it was forming its whole other like own dimension, to speak in like scale development terms, and it wasn't quite fitting with this construct of water insecurity. So perceptions around quality are both related but different too. So we saw that it was really related. Like, if you think your water quality is poor, you're going to affirm one of these other items because you're shifting your behavior in some way, or you're feeling upset or angry, or you're don't have as much to drink as you would like, which is one of the items. But yeah, great, very good question. I know. I'm going to quickly pivot to something. Okay. Greg and Simon, I'm going to keep talking. You're welcome to stay around. I know you're busy people with like very different time zones right now. But welcome to stick around for the last 15 minutes. I'm going to talk about a new tool that we're developing for institutions. And I'm about to have tech problems again. But if we could just do a round of applause in case we don't get to do it. Thank you, Simon. Thank you, Greg. Let's see how I can do this. Oh, it's literally, okay. Thank you. I'm feeling like classic academic. Yeah, okay. Oh, I feel bad covering up. Okay, and this is me trying to add your slides in, but I made it look bad. Okay. I'm about to present on where we're going next with this work. So I'll also make a quick plug that this will be touched on a little bit tomorrow at a session at 8:30. So if you're able to get caffeinated awake and you haven't flown out of Chapel Hill yet, please come on through to talk about it. I have a quick 5-minute slot, and there's much more qualified people talking about these things. But just to say that there'll be more to expound upon on this. No surprises, water issues exist beyond the household. And as soon as we made these measures, as soon as we made the household version, it was, okay, now let's make an individual version. And then as soon as we put that out and presented it to great folks like y'all at Water, UNC Water and Health, it was great. I would love to apply this to institutions. And JMP is also right again there of now taking on the really hard task of finding data that are comparable and consistent and good for measuring wash in institutions. So beyond just water, but also thinking about sanitation, hygiene, waste management, and environmental cleaning in something like a hospital. So the baseline report came out, I believe, in 2018. So this is also new ground that we're breaking as just like a global community of trying to reliably measure wash in institutions. And I think this is reflected in the data from their 2023 report, came out this year, if I'm remembering correctly, last year. And so you can see that this is showing the amount, the percent of the population with data on these things that they're measuring, like basic water in institutions, basic sanitation, and basic hygiene. There's not enough data for them to feel comfortable about making global estimates around basic waste management or basic environmental cleaning. And you can just see how much data are just like insufficient data to provide nuanced breakdowns within these things. But to say, this is really important data, and it's great that it's being collected and reported on, and that they're taking on this challenge. And they're also not just thinking about healthcare facilities, but also schools. You can think about how difficult it would be if you didn't have reliable access to water as a kid or a staff member of grubby kids, also using sanitation facilities, and the importance of that of like school attendance and recidivism. So bit better data here, but by also this has been relatively new reports of getting to report on this and looking at where we're at. Some of the data are looking pretty good, still also off track though. So these are looking at projections of how we have to accelerate progress to meet these needs. So big undertaking of both like a data gap, but also just the challenge of meeting these needs. And it matters. We are measuring this because there is real implications for this. So having better wash services in these institutions is related to higher school attendance and also school performance. Mixed data, but most meta-analyses show that. Risk of NCDs and also like hospital acquired infections typically go down with better access to water. Outcome of patients, patient and staff satisfaction, that matters for retaining people at your facility, for having people come to your facility and not opt to just stay and use care at home or refuse care at all because they don't think that the healthcare facility is clean or performing as well. And also just the dignity and safety of having a safe place, for instance, going to school, to go to the bathroom, to manage menstruation, to feel safe going to the bathroom. I mean, you can think of all the reports, and I'm not going to get into it, of like people skipping school because they don't feel comfortable going to the bathroom there or feel unsafe going to the bathroom, or there's also like really severe coping strategies I've heard of people like not eating or drinking before going to school for fear of having to use the bathroom, and the nearest facility is a 10-minute walk away, or it's going in the bush and it's not feeling comfortable or safe doing that. So like I was saying, data are missing for a lot of these. The squares up at the top are reflecting the data we have available for households. Pretty great for water, sanitation, and hygiene. Starts to get a little bit less so for schools and a lot less so for healthcare facilities. So, and that's despite there being a ton of great metrics. We heard about Wash Fit, that'll be talked about more. There's these service delivery indicators that are promoted by World Bank, and lots of PET indicators and other tools that I am now becoming aware of, and people much better in this room, much more steeped in it. But there are a lot of guidelines and a lot of recommendations of how to measure this issue. But most of the indicators, maybe not surprisingly, is we measure what we can see and we measure what's easiest, and that tends to be counting number of toilets, the functionality of the toilets, if they're disaggregated by sex or gender, so things like that. So this is just one example of within the Wash Fit tool, there's a whole bunch of questions and things that somebody is supposed to go and observe, and then you can create these indicators that you can track across time. And for instance, is like the number, if the facility has the number of improved toilets for patients and things like that. So again, counting what is available in terms of infrastructure. Let me see how much time I have. Yeah, I'll blow past this. There's like some stuff published in the literature talking about how user perspectives are really useful. I hope Ryan Cronk is here. I hope I'm not destroying his data or making this, he's not in the room right now, but I'm not totally making the data bad, of talking about they had worked with like healthcare providers, HCPs in this, and were asking about their satisfaction or what their issues were with the lovely dude. A lot of you probably know him. Really compelling story though of different healthcare workers talking about, yeah, we have a piped water system in our facility and it's really great when it works. But again, there are times when it's down and we can't predict it, so that we use this tub of water instead. And you can see that there's a cup on top. So maybe it's going to be filling it with this cup and unknown quality. And there's just like lots of other user experiences. Thinking through another really great one that I've been told by Darcy of, you can measure and see, I believe you told me this, there's like a lot of cleaning products in a facility. And then you might talk to somebody and go, so you're doing the checklist, you go, okay, I see that they have the cleaning things. But then you talk to them and, well, we're actually saving that for a rainy day because we don't know the next time we're going to get the supply. So we're going to use it for the worst situations, but like we need to hold on to that. So then it's not getting applied to the standard or the ways that you can do that. And there's a lot of process measures that also capture it, but it's really complex. So anyways, to say, I think user experiences are really useful here and can provide insights. So we, the royal we of Helvetas, Northwestern, me, UNC, and a lot of consultation with the Water Institute of trying to think of how we can measure wash experiences. And it gets really complex. You can think about, because it's not just a household or an individual, it's an institution with a lot of users and levels of engagement with these services. So you probably heard us talk about this last year, maybe you heard about it, but we are still at phase 1 of what you do to develop a scale, which is identifying the domains and creating the items. And so that's been going through the literature, trying to see how we traditionally measure this. Expert feedback, the Delphi method involves, if you're not familiar with it, is basically you identify experts in a field and you give them the survey items that you've pitched or what you're thinking of, and you get their feedback, and it's anonymous. And then you bring it in, you look at it, and then you send it back out to them for consultation. And it's just one way of starting to get at like knowing, are these good items? Are these totally bogus and are going to perform poorly? Like trying to catch the items, or, hey, you totally missed this really important experience. So we're at that stage. We have 50 people that have given feedback on it. And if you feel so compelled, please let me know. We're still in the first phase. I haven't fully closed out the survey. I don't have a link here yet, but I could send it to you because more feedback is better. We really mean that. Be mean, tear it apart. We have to have that. Starting to dip our toes into phase 2 of looking ahead, of implementing. We have Nepal lined up to do this in probably February or March to start. We have study sites, we have IRB, and we're going to implement it in both schools and healthcare facilities. Within schools, we identified 2 core groups, students and then staff. And then within healthcare facilities, we have patients, medical staff, and then healthcare, like the people involved in the sanitation, the cleaning, those are like the major groups right now, and aspirations to maybe go further someday, and nowhere near phase 3. That requires data and a lot of it. I'm going to stop there because that's kind of where we're at with the project right now. It's early. We have a lot more to go, but we're still very much in the phase where I want to hear from y'all, and I know we're actually at time. So feel free to reach out to me, but I think maybe what's better is just a reflection of, here's everything we kind of talked about. If you want to get involved with the healthcare facility work or the school work, or you have any questions about the tools that I already presented on, feel free to reach out to me directly, and I can get you in contact with these 2 folks, but feel free to reach out to them. And then also, if I hadn't blabbed on for so long, I was going to have y'all talk about this and go around in conversations, but if you're interested, you're welcome to take a look at the surveys now. These are draft surveys, not meant to be used. They're going to shock you at how long they are. Cast your mind back to where I said we went from 32 items down to 12. Some of these I'm thinking we're looking at like 50 right now, because there's just a lot more to capture there, but we're hoping to get it down to something more manageable, like 20. So look at it. And if you want, again, feel free to approach me and I can give you the survey and you can go through each item and say what you think about it and how you would change it. But I know we're at time, lots of other interesting presentations, coffee, things. So just thank you all. Thank you to the presenters, and thanks for listening. And yeah, we'll let you be.
Thank you, Josh.
Oh, Greg, you're still here from high above. Yes, thank you. Take care.
Take care.
Yes.